Well, thank you everyone for joining us today. We've got a great webinar on tap today for our monthly Lunch and Learn program. Today we're joined by Dr. Afton Hassett, and she's going to be leading a session on chronic pain reset. But before we jump into that, I do want to just go over a few housekeeping details to make sure everyone's connected properly. If you are connected properly, you should see slides on your screen, and you should be able to also see myself and Dr. Hassett on screen, as well as hear us. If you are having any audio or video difficulties, please try logging out of Zoom and then logging back in. If that does not resolve the issue, please message me directly in the chat and I'll be able to assist you. If you're viewing this webinar on your phone or on a tablet, you may need to swipe left or right to be able to see the presentation or the speaker. And so today's webinar is being recorded and will be made available by Friday of this week on our YouTube page. That YouTube channel is Scleroderma US. I'll also put that link in the chat a little later in the webinar in case you're curious. The National Scleroderma Foundation in no way endorses any drugs, treatments, clinical trials, or studies referenced in today's webinar. Information is provided to keep the listeners informed. Because the manifestations and severity of scleroderma vary among individuals, personalized medical management is essential. Therefore, it is strongly recommended that all drug treatments be discussed with the individual's physician for proper evaluation and treatment. Again, this webinar is for educational purposes only. We will have a Q&A portion at the end of this webinar, so please feel free to use the Q&A in the chat feature to ask any questions, and we'll get to those at the end of the webinar. All right, so with all of that out of the way, I'd like to introduce today's speaker. Dr. Afton Hassett, is an associate professor and director of pain and opioid research in the Department of Anesthesiology at the University of Michigan. As a principal investigator at the Chronic Pain and Fatigue Research Center, her research is related to exploring the role of cognitive, affective, and behavioral factors in chronic pain populations. Her life's work is dedicated to helping people with chronic pain live lives with less pain, greater happiness, and renewed purpose in life. Today, she will be talking about her book, Chronic Pain Reset, 30 Days of Activities, Practices, and Skills to Help You Thrive. Thank you for joining us today, Dr. Hassett. The floor is yours.
Oh, thank you, Angel. I really appreciate it. And thank you all for inviting me to be here today. Let me pop up my slides. Great. You see them okay?
Yep, they look great. Thank you.
Okay, great. So I'm going to talk to you a little bit about the pain work that we do and what we understand about chronic pain. And then we're going to talk about it in the context of my book. This is kind of a life love, something I didn't even know I was going to write. It was a period during the pandemic where I felt like I probably could do something better with my time than binge watching a lot of shows. And so I thought it might be cool to translate all the work that's being done at the Chronic Pain, Fatigue, and Research Center at Michigan, as well as many other groups around the world that are doing such exciting work in chronic pain and helping us understand the neurobiology and new interventions that work. And by being able to translate this to people who live with chronic pain, it just felt like a right thing to do. And that's a year later and a lot of aggravation. I actually have a book. And so I want to talk a little bit about that. So these are my financial relationships to disclose. I do some consulting for a company that also builds behavioral pain self-management, digital tools, and of course the book. This is the book here, 30 Days of Activities, Practices, and Skills to Help You Thrive. So I'll walk you kind of through the book while walking you through what we understand about pain. So we'll begin with the notion that pain occurs at epidemic proportions. It is really, truly one of the biggest and most fiercely growing problems we have today in terms of health. We'll talk a little bit about neuroscience and how what we understand about the brain can help us unlock the mysteries of pain and so we can better treatment. And as such, we'll talk about how thoughts, emotions, our relationships, and all of our actions, how these actually impact not just how you experience pain, but how pain is processed in your brain. And then we'll talk about some resilience strategies to help you build pain resilience, but not just pain resilience. These strategies are great for everybody in many aspects of life. Many of these translate to just the people that you hang out with who do not have chronic pain. And then in the book, we have something called a challenge where it's 30 days that you try these evidence-based strategies. You try one a day over 30 days and pick out your favorites. So I'll talk a little bit about that. And then once you have tried those new strategies over 30 days, you pick the ones you like the best and you build a thriving plan. And so we'll discuss what that's about. So let's begin with the epidemic of chronic pain. So chronic pain refers to pain that lasts greater than 3 months. About 20% of US adults experience chronic pain. That's about 51 million Americans. It tends to disrupt daily work, life activities, our goals, who we are, our sense of self, and it is associated with other medical conditions such as depression, Alzheimer's disease. We see it also associated with well-being and psychiatric things like higher suicide risk, misuse, substance misuse and abuse, as well as depression and anxiety. And we know that about 7% of Americans experience high impact chronic pain, meaning that the pain is incredibly disruptive to many areas of their life, including work and family life. And we see that chronic pain is growing at shockingly high rates. If we look at the number of new cases of chronic pain, it far outnumbers the new cases of diabetes, new cases of depression, or even new cases of hypertension, which is incredibly common. So we know that chronic pain of scleroderma is also common and often problematic. So we see that pain is reported in about 75% of people with systemic sclerosis, and often it's resistant to treatment. And so you don't get a lot of relief. It tends to be quite stable, though it kind of can kind of wax away and become more severe and less severe. And sometimes there are flares that even make it, more profoundly impactful. And these flares within scleroderma can last 3 days to even 3 months. And what we also see is that if you have a better sense of your ability to control your pain, you actually experience less pain. So the impact of pain is less painful, and it also impacts your life less. You have less pain interference in your daily activities. And we see that people with scleroderma who report worse self-efficacy for dealing with their pain are more common than in other conditions. So it could be the failure of our healthcare system to adequately prepare you for how to most effectively deal with your pain. We see that this is a bigger problem than in cardiovascular disease or breast cancer. There, they have more education potentially and more tools than you might even have. And so we want to help change that. So because chronic pain is so complex, we often need real complex approaches. We can't just give somebody a pill. That rarely works. We know part of the complexity has to do with chronic pain doesn't occur in a vacuum. Often people will report that they have worse sleep, greater fatigue, difficulty thinking or remembering or recalling things, and feelings of depression or anxiety. So this cluster of symptoms tends to follow along with chronic pain. And you may be nodding your head thinking, this is what I experience too. Because of the complexity, treatment often is complex. We need often medications to help either control the inflammation or to help decrease other experiences of pain. Sometimes interventional pain management is used. This is where people can get injections or other procedures. Physical therapy and exercise is almost recommended for everyone with chronic pain. Some level of physical movement, stretching, or exercise or rehab seems to be important. But so are behavioral therapies. And behavioral therapies refer to any kind of psychological oriented therapy. Doesn't mean that we think you're crazy or we're going to change how you think. We just know that there are skills, tips, tricks, and things that you can do differently, behaviors that you can do to make your pain better. And that often falls under the notion of pain self-management. Once we've done a good enough job offering you the tools, you start becoming better able to manage your own pain. So let's talk briefly about neuroscience. This is the study of the brain. And the more we understand about the brain, which we actually understand not as much as we would like to, but we do know one thing: pain is in the brain. We need to have our brains functioning to process pain. We also know that all pain is not the same. There's different types of pain. So one interesting example is to show you this. Now, when I show this to my physician friends and I say, hey, which of these two knees hurt? They're pretty quick to pick out that knee on the right. This is osteoarthritis, or an example of osteoarthritis of the knee where you see bone touching bone on that right hand knee, right there, right? That, by all accounts, should be painful. But what's surprising is these and many other citations at the bottom of the screen there suggest that our MRIs often don't map on very well to the pain that someone's experiencing. So somebody can have a knee that looks like that on the right where the arrow is and have no pain, whereas somebody can have a knee on the left and have shooting terrible pain, even though we don't necessarily see what could be the explanation. So we think this is true predominantly because there is not just one type of pain. There is the type of pain we think of most frequently. This is nociceptive pain. This is when you burn your hand on the air fryer. This is if you cut your knee bumping into the wall. This is pain that occurs because of mechanical damage, some sort of tear or rip, or inflammation. So your joints might be inflamed. This is what we call peripheral because it happens outside someplace of the body, as opposed to central, which would be in your brain. So this type of pain responds very well to NSAIDs, so any kind of anti-inflammatory over-the-counter medications. And opioids respond to that. It also responds to procedures like injections and surgery. If your if your hip or your knee has bad osteoarthritis and replace the hip or the knee, the pain tends to get much better. Examples of kind of peripheral or nociceptive pain are injury, osteoarthritis, rheumatoid arthritis, or even cancer pain. All of these pains come from someplace out there in the body. Then there's neuropathic pain. This is what we think of when there's some sort of nerve damage or a nerve that's being ground on in the back vertebrae. So this type of pain responds well also to anti-inflammatory medications, but also calcium channel blockers and antidepressant types of medication. It responds to many different types of medication. And antidepressant medications, the reason that works is because the antidepressant system works on very similar neurotransmitters as does the pain system. So serotonin and norepinephrine is used often to treat depression, but it's also used to modulate the pain system and to make pain better. Classic examples of neuropathic pain include diabetic neuropathy or post-herpetic neuralgia, or just somebody who has a nerve in the back. It's pinched. And the third type of pain is what we refer to as non-nociceptive, meaning the pain isn't coming from someplace out in the body per se. The pain is often characterized by changes in the brain, in the central nervous system. And this disturbance in how the brain processes pain can amplify the signal. So a little signal could come in from outside, like a pinch, the brain would amplify that and make that pain seem so much worse. Or pain can take place with no input at all. Somebody can experience pain everywhere in the body, as is the case with fibromyalgia, and yet not have injury throughout the body. It is just the central nervous system, the brain is creating this pain and making us more sensitive. So classic examples of nociplastic pain are fibromyalgia, irritable bowel syndrome, tension headache, and other common overlapping pain conditions. What's so interesting, though, is we often see these different types of pain, these different mechanisms of pain in the same person. So we'll often see somebody with rheumatoid arthritis or, say, scleroderma who also has potentially neuropathic pain. They might have an impinged nerve, or they could have a fibromyalgia-like pain as well. They can have, scleroderma, inflammation in some areas, but have fibromyalgia throughout. And this makes it tricky for us to treat. And it's why so frequently people don't get the relief that they're seeking because not all their types of pain are being treated. And to make it even more tricky, because pain is processed in the brain, our emotions and our thoughts also add to the sensory experience of pain and can make it worse or they can make it better. So all of these things impact how pain is experienced. And this is primarily because many of the areas of the brain that process pain also process our thoughts and emotions. So that can be help explain why when you're very stressed out or very angry, perhaps your pain feels worse. Or if you're laughing and really enjoying a moment, perhaps you don't feel your pain at all. All of this works together to create a feeling of pain or less pain. And we know that maladaptive thoughts like pain catastrophizing, fear avoidance, pessimism, all do indeed make pain worse. While thoughts like having good pain self-efficacy, meaning that you've got the tools to deal with your pain, even though you feel like you can deal with it, or feelings of optimism make pain feel less painful, make it better. Intense negative emotions like depression and anxiety make pain much, much worse. Whereas feelings of joy, calm, happiness, and intense laughter can actually buffer the experience of pain, make pain almost not feel like anything. Processes like social isolation or feeling lonely make pain worse, while social connection make pain better. And I show this picture of people dancing to Gangnam Style because it was part of a study done by Tar and colleagues who had people together in small rooms dance happily to Gangnam Style, doing this crazy dance, and then they tested him for pain. Their actual experience of pain after dancing was much less. So that being together, dancing in synchrony actually made pain better. So these little studies tell us all sorts of things about pain that open the door for why emotion focused, resilience based types of interventions can make a difference. So, neuroscience tells us that our thoughts, our emotions, and our sensory experiences are indeed brain events. These happen in the brain, and many of them are processed by the same area of the brain. In many cases with chronic pain, damage or tissue injury is optional. It might not be there. The brain could be doing this on its own. And that psychological, emotional, social, cognitive, and attentional processes are all linked to the experience of pain, and we can influence pain by influencing these processes. And that the changes in brain networks that we think underlie chronic pain are not hardwired. They can change too. So the notion of neuroplasticity that our brain continues to mold and change makes it possible for small actions to make a big difference. And our book is all about these small actions you can take to build resilience. So resilience is the notion that life is hard. There is adversity in everybody's life. And what matters is not how bad the thing was that happened in your life. It's like, do you have the resources to overcome it? And if you do, you will become stronger on the other side. Like Friedrich Nietzsche said, that which does not kill me will make me stronger. When we think about what is resilience, it really is our ability to respond to adversity. It is a trait. It is something that some of us are just good at, right? You can even tell some babies that are resilient early on. But resilience is also part of a dynamic capacity that can change, that they can get stronger over time. The more we expose it to adversity and we overcome it on the other side. It is malleable. We can build resilience by doing targeted interventions. And we are not resilient or resilient. We are somewhere on a spectrum, right? So some people tend to be a little bit more in the low resilience. They have a greater difficulty adapting when things happen and they have more trouble recovering. But they're there, they roll along. Most of us are moderately resilient, that we can adapt pretty good. We have some resources in our lives to help us get by and to recover. Some people are highly resilient and they're really impressive. These people can really weather the tide. And what they tend to do too is move into this category of actually thriving. So the more resilience that you have, the more tools you have, the more likely you are to thrive even in the face of adversity. And once you get through the hard thing, that your life might even be better than before. Your life could actually feel fuller, more meaningful, or more rewarding once you have weathered whatever storm it is, be it illness, the loss of somebody you love, financial strain, whatever it is, we can get stronger. And we care about this in research because resilience strongly predicts how well people do with chronic pain. It'll tell us whether or not they even have chronic pain, how much medication they use, how's their quality of life. More resilient people sleep better, they have less depression and anxiety, and they just have better psychological adaptation. So people who are more resilient tend to cope well, cope better with their pain and with life overall. When we study resilience as a concept and try to devise interventions that can help, we try and think about, what are the most important components? And it appears to be kind of three things. Our tools for improving resilience include our thoughts, our emotions, and our relationships. So when our thoughts are more optimistic, when we have a greater sense of purpose or of self-efficacy that we can control things, we're more resilient. If our emotions are more positive than negative, we tend to be stronger. And when we feel connected and supported by those around us, we are definitely going to be more resilient. So let's talk about each of these three for a minute or two. Let's talk about these thoughts. So we've been mentioning self-efficacy. So self-efficacy refers to the belief that you have the capacity to exert control over your behavior, your situation, over the motivations that you have, your environment, your health. You've got a sense of, I have some power here. And in studies that look at self-efficacy in people with chronic pain, in a meta-analysis that looked at 86 different studies, 15,000 people, they found such good evidence that self-efficacy can be very protective for people with pain, including helping them function better, have less psychological distress, and even improve their pain severity. So we want more self-efficacy. We want to increase our confidence in ourselves to cope with our pain and our illness. We also want more optimism. So this is a study that I conducted with my colleagues Dan Claw and Martin Seligman and the crew over at the Research Facility Laboratory as part of the U.S. military research arm. And what we wanted to understand better is because chronic pain is such a problem for post-deployment veterans, we want to understand, are there any protective factors that could help people be less likely to come back from combat with chronic pain? And so we looked at over 27,000 US Army soldiers who had many deployments. Some had like 5 and 6 deployments over time. And what we determined is that from baseline to the final deployment, we learned that about 37% of these soldiers all developed chronic pain in a new area. If they didn't have it before, they had it now. If they had it in their back, now they had it in a knee or some other place, right? So their pain got worse after deployment. When we looked at the factors that were protective, you might guess by the slide, it was optimism that was so protective. When we compared the most optimistic soldiers to the least optimistic soldiers, we saw those who were low on optimism, the least optimistic soldiers were 35% having the greater odds of being the people who come home with new chronic pain. And what was fascinating to us is this was true, even controlling for military factors, like whether you're an enlisted man or a officer, or the combat factors. Were you exposed to battle? Did you see somebody hurt? Were you hurt? Did you see dead bodies? What did you experience? Even taking into consideration, optimism was still incredibly protective. And we see this across studies everywhere. In another review of many studies, they looked at 69 different studies of pain and optimism and found that 70% of these studies showed that optimism really helped with pain outcomes. The more optimistic people did better. And when they looked at the quality of the studies, the better studies, the highest quality studies, and those high quality studies, they found that 92% of those studies showed that optimism was indeed protective. So the better the study, the more it showed that this is a powerful, important thing. And then the third thought that's really powerful is purpose, that we need to seek purpose. And sometimes when we're ill, our sense of purpose changes. And people who do indeed have purpose in life, despite whatever circumstances they have, do better because it helps guide the decisions you make. It helps you shape your goals. It influences the behavior, the things you do day to day. It can give you direction. If you know what your purpose is and which direction you're going, purpose in life just creates meaning and gives you a reason to get up every morning. So we want purpose in our life. This is a focus of the book. How do we get more purpose? We want more purpose because, again, the science is very good. People who have lives that are filled with purpose are less anxious and depressed. They eat better, they sleep better, they have better willpower, they have fewer heart attacks, less risk for Alzheimer's disease, better immune functioning, they fight off new infections better, and they have better pain tolerance. So, yes, we want purpose. We want self-efficacy, we want optimism, and we want purpose. We want to build those. These are citations for all of those kindness findings. Let's talk about emotions. What do we want as far as our emotions? We as humans have lots of negative emotions: fear, anger, depression, envy, hate. You'd think these are all the emotions we have based on what psychology is focused on for most of its time, right? We work on getting rid of these negative things. And I guess that's important. Yes, it's important. We need to think about negative emotions because they do associate with all the things we don't want in pain, in chronic pain populations. More pain, more disability, more medication use. It's everything bad. But fortunately, we aren't just made up of negative emotions. We are complex beings with lots of positive emotions too. And thinking about happiness, love, calm, enthusiasm, gratitude, passion, all of these positive emotional states are important to people with chronic pain and now are being studied more than ever. This is where I dwell. This is my area of expertise in understanding how positive emotions can help spare people from their pain and disability. And many researchers have shown that people with higher levels of positive emotions experience all the pain outcomes we hope for: less pain, less medication use, less disability, just better, richer lives. And we unfortunately see in many chronic pain populations many more negative emotions than positive emotions, as if there is this emotional imbalance, right? In healthy adults, we want to have one negative emotion for every three experiences of positive emotion, right? We see the opposite in chronic pain populations, where maybe there's two or three negative experiences of negative emotion to one positive experience, right? So there's just many more negative emotions on board in chronic illness populations, not just scleroderma, and most. And we think this is probably because we have to make a priority. We have to do the things that we have to do, right? And so you have to work, you have to get the kids off to school, you have to run errands, you have to balance bills. And then there is no more energy at the end of the day. And so we put aside the things that we love doing in favor of the things that we must do. And over time, this is a hard way to live. The meaning in life gets lost, our sense of purpose gets lost, our valued friendships start to suffer, we lose joy. So all the things we want to build to give us resilient and buoyant lives in the face of pain disappear just because we aren't necessarily prioritizing them. And so I'm going to give you a permission and a prescription, if I could, to prioritize some joy for yourself. So before we move on, this is a good time for a pop quiz. I'm going to give you a pop quiz. All righty? So Julia Holt Lundstedt conducted a meta-analysis. I mean, she gathered many studies that looked at protective factors that would stop people from dying, from mortality. And they found in their studies, when they looked at all the studies that examined clean air, they saw that clean air definitely decreased mortality. Fewer people died if they got clean air. People who were treated for hypertension, for high blood pressure, in those studies said, yeah, no, people were less likely to die. And it's a pretty good effect. And then in all the studies that looked at having a lean body mass as opposed to a high BMI, that was protective too. And so on with exercise, just getting a flu vaccine, drinking less alcohol, all of those contributed to less mortality. And then the big kahuna, less smoking. The studies that looked at less smoking, by and large, showed a huge effect for a way that we could decrease mortality if people smoked less or stopped smoking. But lo and behold, The group that conducted these studies were shocked when they found that there was one factor that was even more protective to stopping death and decreasing mortality than smoking. And if we're in a room together, I would ask you what it is, but I'm going to tell you: social support. Feeling socially integrated, feeling connected to others, not being lonely. That was the most protective factor against mortality of all of these, more so than smoking. So our relationships are critical to our health. They're the most important thing that we have. Our relationships impact both our mental and our physical health. They do this through many pathways, including behavioral pathways, psychosocial pathways, and even physiological, biological pathways. So there's many ways our relationships impact our health. The good news is that healthy, strong relationships are protective. The bad news is that unhealthy relationships that may be abusive or neglectful or manipulative, these relationships cost us our health. And there is a cumulative impact. The longer that you're in these positive, loving, supportive relationships, the better health outcomes you have. The longer you're in these negative, abusive relationships, the worse your health outcomes. So we want to choose carefully. We see that there is a strong association between social isolation and life satisfaction, specifically in systemic sclerosis. So social isolation and life satisfaction are hand in hand. We also see that resilience is a protective factor in systemic sclerosis, and that it actually impacts the impact that social isolation can have on life satisfaction. Meaning that if you are kind of isolated and feeling a little bit lonely, but you're a resilient person, you've built your stores of resilience and strength, you're less likely to have poor life satisfaction, right? So these things work together: our resilience, our social relationships, and our health. And this is shown even in scleroderma. This is a study that we had done together, led by Yen Chen and my colleagues at University of Michigan. So now the book takes us to a 30-day experiment. So I've touched on many of the topics that we talk about in the first 14 chapters, but many, many more. We talk about awe and spirituality and our friendships and the crazy way things that we think and behave. But once we get through those chapters and have a good sense of human psychology, of pain, and of the neuroscience, then we have an experiment in the book. And I challenge you to try 30 different strategies in 30 days. And in the book, you'll pop open a two-page entry per day, and it'll introduce to you a strategy. All of these, almost all of them, are very well evidence-based. They've been shown to be helpful for people with chronic pain. These do not appeal to everybody, and that's why we have this 30-day experience. So you'll look at each of these strategies and read about it for a moment, and then try it. It gives you a suggestion of how you can try this for the day. And at the end of the day, you come back and say, that was for me, or that was not for me. That's silly. I don't like that. And at the end of 30 days, hopefully you've identified a few of them that you really like, and maybe some others that you think you might be interested in doing. And at the end of the 30 days, you pick the ones you like the best for a thriving plan. So a thriving plan. At the end, we'll talk about what that is. But let's talk a little bit about some of these strategies. I provide a few of them here for you. So in the book, we organize kind of the strategies by what they impact. And when we treat chronic pain in the clinical sense, we're very interested in not just making the pain better. We know that we can make the pain better by changing aspects of this domain. So yes, we can directly impact pain, but we can also indirectly impact pain. So we know that one of the important domains we need to consider is relaxation, because if you are less stressed, more relaxed, more mindful, you're less likely not only to experience pain, but you're more likely to have a much more successful life, to do the things that you want to do, to be able to pace yourself. So relaxation is a key domain we care about. We care deeply about better sleep. Most people have some nights of insomnia almost every year at some point. Many people with chronic illnesses have insomnia all the time. So working towards better sleep is a key domain. Also in the book, we talk about the importance of physical activity. And once your doctor says it's safe for you to move, you should move, but we want to make it movement that you love and you're willing to do. If you don't like going to the gym, we don't want you going to the gym. We want you doing the things that you love, that you'll engage in and keep doing. Another key domain we think about is more to adaptive thoughts, as we were talking about earlier in our talk, that, we want people to think these more helpful thoughts. We want people to have more positive emotions. Not that negative emotions will go away or not to be, thought of, but the more we layer on positive emotions, the better we can deal with our negative emotions. Another domain is social connection, so we build our strong relationships. And the last domain is meaning and purpose. And the goal of a thriving plan is to work in one or two of these domains at a time over time. And perhaps later in the process, you'll really focus on meaning and purpose, but that's for you to decide. And the book will help you walk through and decide how to build the best thriving plan for you. So we're going to try some of these exercises, okay? So in one of the domains in relaxation, we have a number of exercises that you can try, and one of them is called 3 breaths. And so we're going to have you do this. So let's say it's the day that you have 3 breaths, you'll open up the book, you'll read about what it is, and then you're going to give it a try, just like we will now. So get yourself kind of comfortable, kind of shake out the stress from your back, sit up a little bit, and the first thing you're going to do is you're going to take a breath in, a rich breath in through your nose. Feel the cool air enter your nose now. Breathe in and feel the air flowing into your lungs. Pause for a second, and when you're ready, breathe out fully through your mouth. Feel all the breath all the way out. Okay? You can take a breath now, just a relaxed breath, and we're going to take one more breath. This next breath now, you're going to inhale again, just like you did before, nice and deep, air through your nose, feel the cool air in again. Become aware of the tension in your body. Where do you feel it? Where do you feel the tension? Hold the breath for a beat, then let it out. And as you exhale, allow that tension to shake out of your body. Picture just melting from your body. And breathe comfortably for a moment. You can circle your neck, as I like to do. And with the third breath, you're going to mindfully, slowly breathe in again through your nose, feel the cool air in, and pause. Hold your breath for a moment. And as you breathe out heavily, ask yourself, what really matters? Often when we're stressed, it's because we're worried about all these little things that are in our world that are overwhelming, and we lose sight with what really matters. And when we think about what really matters to us, we're able to let go of all the little stuff. So here is an activity or strategy from sleep, the better sleep domain. Okay. If you're not a good sleeper or you would like to sleep even better, sleep time stabilization is a really great technique to try. Sleep time stabilization. Oh, I'm sorry, I have the wrong words up. Sleep time stabilization means something simple that you do every day. And that simple thing is get up at the same time every morning, if it's 8 o'clock, 7 o'clock, 9 o'clock, whatever it is, and go to bed at the same time every night. This means the weekends and the holidays as close as you can, a half an hour here and there doesn't hurt. But when you're trying for the initial stabilization period, for the first couple of weeks when you're really trying to make a difference in your sleep, follow this pattern. And if you go to bed at 8 o'clock and if you go to bed at 10 o'clock and don't fall asleep to 3 in the morning, still get up at 8. Still get up at 8, even a short night. And if you are really, really tired, and you make yourself stay up to 10, right? Don't go to bed early. It's a challenging thing to do, but our body loves this rhythm, just knowing that this is a time you go to bed, this is a time you wake up, and your entire biological clock will shift after a few weeks. It takes it a few weeks to do that, and it'll make sleep much easier if you're doing this. Your body knows what to expect and what to do. Here is another technique that a lot of people seem to enjoy. This technique is part of more adaptive thoughts, how we can do a much better job of thinking thoughts that don't stress us out. So, coping coach suggests that you're probably a great friend to your friends, right? Are you a good friend? Do you help people see the good in themselves and how sometimes they might being too hard on themselves and how to forgive themselves? And also, are you quick to forgive them and to forgive others? We often are much better friends to our friends than we are to ourselves. So, what would it take for you to treat yourself with the same kindness and consideration as you do your friends and family members that you really care about? Right? So, you can become your very best own coping coach by just doing these simple things. Catch yourself engaging in negative self talk. So, catch yourself when you're bullying yourself, telling yourself, I was so foolish to have done that. Oh my gosh, everybody's talking about me. Why did I do that? That was so silly. Catch yourself in those patterns. And when you find yourself in the pattern, think about if the situation were reversed. If your friend was saying all these things, what would you say to him or her? What would you say to your friend if they were experiencing these negative feelings? You'd probably say, hey, everybody makes a mistake. It's really okay. You do so much more and you are so much more than this small mistake. So think about telling yourself the same kind things that you would tell your friends. Become your own best coping coach. When you do this, think about the phrases that make the most sense to you too, right? So come up with things that ring true to you, like you can do this, be strong, I am loved, everybody makes mistakes, I got this. Create positive mantras for yourself that you can call in any time. I've had people engrave them on necklaces. Tattoos don't necessarily suggest that, but there are ways that you can remind yourself, this is who I am. I am loved. Everybody makes mistakes. I got this. All right. Another activity that we love that is in a different domain. This one actually taps into several domains, into positive emotions and also physical activity, and often social connection, depending on what this is. So, pleasant activity scheduling is a very highly evidence-based strategy that comes from cognitive behavioral therapy that tells us that we probably aren't prioritizing the things that we value most when we talked about kind of these valued life activities that we put aside. And what pleasant activity scheduling tells us to do is for the first time you try this, pick 3 days or even 5 days and just set aside a little bit of time. It can even be one day if you're going to do half a day, whatever it is. Put it on your calendar, treat it with the same respect as you would a doctor's appointment, right? Make this thing something that you are dedicated to. I'm a golfer, and so I love to set aside time, set aside a few hours. So do this. It can be a small thing. It could be having coffee with a friend. It could be engaging in your hobby. It could be going shopping and getting a massage. It could be just curling up with a good book or taking your dog on a nature hike. Whatever it is, do this thing that you value. When you do the things that you love, it makes you more resilient. And there's going to be more of you down the road to take care of other people, to do these other things if you take care of yourself regularly by doing some things that you love. So set time aside to do pleasant activity scheduling. A intervention that goes directly at positive emotions, the domain of positive emotions, is positive piggy bank. This is something that we created ourselves at the University of Michigan to help people before surgery have something fun that they can do to help them build a positive emotion before a stressful event. And so what we do is we give people a piggy bank, but it can be a box, it can be a jar, it can be whatever you want. And what you just need to do is have some scraps of paper and a pen, and you follow these instructions. The instructions are every day think about the people, things, or events that make you happy. You can make a list, but pick one of these events from the day, spend a moment savoring it, and then write it down on a piece of paper. Use some detail. So if you were to read this down the road, you remember what the event was. You can date it if you like, fold it up, and put it into the piggy bank. Do this every day for however long you want to do it. It can be 2 weeks before a stressful event. It could be 30 days. It could be done with your whole family at dinner time. Everybody throws one in, and after 2 weeks, you're going to look at them. I've had people do it for a year and they peak every month, but then at the year, they're going to look at them all. So you can do whatever you want to do. And at the end of that time, close the account or just take a withdrawal and read some of these slips, these currencies of positive events that'll help you remember all the good in your life. Because we often don't do a good job at storing these positive memories, not as good as the automatic memories that are stored when bad things happen, right? We have to be intentional to make good memories more sticky. Another domain for positive emotions is something I use because we just talked about positive emotions, but this is really a good strategy for negative emotions. So I'm going to share this with you too, since this is for self-soothing. So when you're feeling really, really stressed, you want to deactivate that stress, right? If you're feeling intense anger, intense fury, intense fear, you can't think through it until you kind of calm yourself down a little bit. And one of the most primitive things that we have are our senses. And so you might know already which of your senses are your favorite. Is it taste? Do you really like food? Does chocolate cake just make the negative things melt away? Is it scent? For me, it's scent. Smelling things just automatically calms me down, the things that smell good and happy. It might be a warm shower. You might be a tactile person, or the feeling of a wonderful cloth. It could be art or the sights, things that you see. But use your senses in the interim to calm you down. Have a strategy. So if you carry with you something that's soft that relaxes you, you have your favorite hand lotion that you can treat like aromatherapy when you smell it. Have the fun videos that you love on your phone and take a moment and deactivate those negative emotions. Once you do that, you can actually regain your thoughts and be able to kind of talk yourself down. A coping coach can step in and say, hey, you're being too hard on yourself. Social connection, one of the other key domains. We want to build our sense of connection to others. And sometimes it's hard because we're at home. We may not be out there in the world too much. So you have a great tool right there with you. And I'm going to challenge you to do this, not now, but do this after the talk. So Text to Connect says that every day for the next week, what you're going to do is you're going to scroll through your text line and find somebody you haven't talked to in a long time. And like, wow, oh my gosh, I've not talked to this person in 9 months. And so reach out to them. Tell them, hey, I was just thinking about you today. Hope you're doing well. Just, I really enjoyed the last time we got together. Maybe send them a picture, but just reconnect with that person. Send that text out. You'll be surprised what wonderful texts you'll get back and how you can respark some of these connections. Do that every day for the next week and see what kind of fun things you might get back. And more than anything, you're going to make people on the other side of the text smile. And then lastly, the final domain is meaning and purpose. There are many interventions that can help us build our sense of meaning and purpose, but I think gratitude practices may be one of the easiest for us to access and to help us figure out what is valuable to us. If we feel like we've lost our sense of purpose, gratitude can help us find it again. So one thing you can do is keep a gratitude journal, which is, I think, a fun and easy thing to do. And when people try this in the book, often they'll try just for the one day and think, you know what, I'm going to start this one now. And you can do that. That's fine. So a gratitude diary just means, write down every day 3 things for which you are grateful. Okay. It can be something big. It could be, my general health. It can be my family. It can be my home. Or it can be really small. It could be that butterfly that just landed on a flower, or I got a phone call from somebody I haven't heard from for a while, or a new text. Whatever it is, write those 3 things down. And every day, though, you need to write something different. And so by about week 2, you'll really start searching for new things to write down. That chocolate chip cookie might make your gratitude list, right? So every day, write down 3 things. Each day, make them a little bit different. And when you do write them down, take the time to kind of savor that. What about it made you feel so grateful? What is the specific elements of it that bring you joy, and feel that moment of gratitude? So there's a sample of 6 or 7, 8, maybe different strategies that are shared. We do 30, and you'll be introduced to 30 of them. And some of them you'll say, that's stupid. You won't do that. And hopefully some of them you'll say, that feels great. I will definitely work on that. And so the last couple chapters of the book help you build a thriving plan. And what that is you start by identifying your top domains. And so you look at the domains, maybe you think that, oh my gosh, my sleep is terrible. I'm going to focus on sleep. I also need to do something with my thoughts. I'm very hard on myself. And maybe, you know what, I've kind of lost purpose and meaning, so I might focus on those domains. And what you do then is you go back and you look at the strategies over those 30 days that you start. We have the ability to kind of color it in. The ones that you start, you want to write them down on a piece of paper and you can match them to the domains. And you can kind of start seeing then, oh, okay, so if I want to focus on sleep, here's a sleep strategy that I liked before. Maybe that's where I start, right? So you pick one or two of these strategies that you've liked. Maybe you rank them by the ones that you really want to do. Sometimes there's just ones that's like, oh, I'd love to do that. Rank them and go ahead, start one or two of them. You don't do them all at once, right? We don't do 30, we don't do 10, we don't do 5. We do one, maybe two. So maybe you like having a nature walk every day, but you also want to work on your sleep. That's fine. They may complement each other, right? So the thriving plan kind of talks you through how this is done and how to build this. And then over time, maybe in 30 days, you evaluate how things are going. Are you feeling better? Are you sleeping better? Is your pain improving? Are your relationships getting better? And then you think, okay, I'm going to keep doing this. This is great. So, what strategies will you retain? What will you drop? And what new strategies will you add? So, every couple of weeks or 30 days or so, reevaluate where you are and add new ones in. So, you'll keep coming back to the book and keep coming back to your plan and adding new things. The idea is that these strategies will become habits. You won't even think about them anymore. It's what you do. It's, you reach out to people regularly, you keep a gratitude journal, you walk in nature, whatever it is, they become part of your long-term plan that will over time make you more resilient. So when tough things happen, you'll be able to bounce back. And so people often ask me, do these fun things actually work? Do gratitude activities and acts of kindness and pleasant activities actually work for people with chronic pain? Well, yes, they do. In a study of studies, another meta-analysis, they showed that these fun little activities actually lead to decreased pain, fewer depressive symptoms, less negative thoughts, more positive thoughts, and less negative thoughts, and that they can last for a long time. And we have put these to work in a study conducted by Susan Murthy and Dinesh Khanna and other folks, Yan Chen from our group, and have added these positive activities, many of the things from them, or some of these things from the book, into typical cognitive behavioral therapy for pain. And Susan and team have devised a really lovely intervention called Renew that was tested in people with scleroderma. It was coached by peers. And what we saw is that 173 people either got the Renew intervention, where they got the coaches as well as cognitive behavioral for pain and some of these positive activities, or they just had a waitlist control. They just kind of hung out. And what we showed is at 12 weeks that the people who got these fun activities, this pain self-management, actually had less fatigue, less pain interference, fewer depressive symptoms, and greater resilience. They actually build resilience in those 12 weeks. So yes, these types of interventions can work for chronic pain, and yes, they can work for scleroderma specifically. So if you're interested in learning more, I'm happy to talk to you. I have a website. The book itself will teach you a little bit more than what we talked about today about the neuroscience of pain and gently translate what we are learning, the exciting things that we're finding. We do through I tell a lot of stories, and I have patients tell their fascinating stories. We will help you explore the role of thoughts and emotions and how these really impact pain processing. You'll try 30 evidence-based strategies in 30 days and eventually build this thriving plan to help you lead a life that hopefully has much less pain and much greater purpose and joy. I mentioned that we have some beautiful essays, 2-page essays by people with lived experiences, fascinating individuals who don't just talk about the path and the misery of pain, but what they learned and how empowered and what worked for them and how their pain has actually maybe made them stronger. Some of them have actually thrived in the face of pain. This might be some of my favorite parts of the book. And then lastly, if you're interested, we have a podcast. We just released our 31st episode of Chronic Pain Reset podcast. It's available on Apple Podcasts. I speak to researchers from across the country and the world, as well as people with lived experience who share just fascinating stories about their experience and how they have either overcome pain, learned to live with pain, or thrive in the face of illness and pain. And so as I close, I just want to have a shout out to the people who do the hard work in my research. I didn't talk about a lot of my research today, but I can't do anything without the people who run my lab. So a big shout out to them. And also as I close, just noting that I am blessed to have incredible research support from the National Institutes of Health. It really is the gem of our nation. And so grateful for the support that they give now, especially to pain and pain management. So with that, thank you for your attention. And I think I can turn it over to Angel to open it up if there's some questions.
Awesome. Thank you for that fantastic presentation. I mean, I learned quite a bit and definitely
Great.
some things that I want to adopt. I want to say that the so many comments of thanks and appreciation for all of the tips and tricks you've taught today. And we'll
Great.
jump in to a couple questions. So first, I'd just like to open it up with where can folks find the book? What's the easiest way for individuals to get their hand on it?
You'd think I would do better. It's clearly I'm an academic and not a marketing person, right? So please, call your local bookstore. I love supporting independent bookstores. The easiest way to get it is it's online at Amazon, Barnes and Noble. If you have an Amazon account, it's nice. It comes to your door free. So yes, yeah, if you go to Barnes and Noble or any booksellers, because it is in many places, it's in libraries too. I get notifications that it is in public libraries too. You just have to ask. But if you just type in chronic pain reset, you don't have to type in the rest of it. It'll pop up right on Amazon and Barnes and Noble. And there's also links at my website. So if you go to aftonhassett.com, you can find links to the podcast, which is also on Apple Podcasts and Spotify, but also more links there too, so it's easier to find things.
Thank you. And
Sure.
we have a question here. Acceptance that there's less energy available is a hard shift for those of
Yeah.
us who have been driven
Yeah.
in our past. Any suggestions for reaching acceptance of new physical limitations?
Oh my goodness, that I love that question. So, it's kind of the notion of spoonies. We probably have heard about that, where there's this idea that if energy is represented in like maybe 10 spoons, people who have scleroderma and other chronic illnesses maybe only have 5 spoons. And for everything you do, you give up one of these, right? So this is getting dressed in the morning. This is going to work, right? So you recognize that it is finite. So part of it is grief, that there is kind of a sense of loss, that you may not be able to do what you have done in the past. But there's also the recognition that you might be able to do a lot more than you think. And some of it is by being very clever on how you do things. Are there ways, are there shortcuts so that you can still do some of these things they want? And also sometimes it's priorities. So they're the things that are demands on you to do that maybe you don't have to do that day. And maybe you can take the time to do that more relaxing thing that's part of the self-care. But yes, I think so many of us go through this, right? It's even part of aging. I'm dealing with my mother who's 85 and she's always been a go-getter. It's like, oh my gosh, I have so much less energy. But she told me, she goes, I'm getting better at figuring out prioritizing, right? And not just prioritizing the things I don't want to do. And so it's like, that's it. So yeah, so we always need to kind of grieve for not being, not having everything we have, but also be smart and prioritize better.
I love that. Perfect. And what would you say to those individuals who, as they're building that resilience, as they're kind of taking these, trying out these 30 different, tips, tricks, and tools, that they may hit those speed bumps, kind of that 2 steps forward, 1 step back. What would you say to those individuals?
I say there's a chapter in there for you.
Ah,
So I didn't write this alone. And so I consulted with another four behaviorists and pain psychologists and talked about, there are many speed bumps for all humans. If we were perfect, we'd all be exercising, healthy people, right? We don't. And so we run into people that get in the way and things that get in the way and energy and motivation. These are all real things. And so I do have a whole chapter that where we kind of talk about all of these potential things that, unravel us. The most important thing, though, again, is going back to coping coach, being kind to yourself. Oh my God, we all mess up and blow things off, and you don't just give up because you didn't feel up to it one day, right? So you would tell your friend, "Hey, it's all right. You didn't do it yesterday. You'll do it today. It'll be fine." So again, it's being forgiving, it's being understanding, it's having reasonable expectations, knowing that you're not going to go out and walk 5 miles if you're not a walker right away, right? So doing things slowly and with great kindness to yourself and a lot of forgiveness.
I love that. Remembering self-forgiveness is so powerful.
Ah,
And
yeah,
yeah, we're coming right up on time.
yeah.
So I want to thank everyone for joining us today. I want to thank you, Dr. Hassett. This is fantastic stuff. And for anyone who is interested in getting their hands on the book or hearing from Dr. Hassett live, she will be speaking at our conference in July. So keep an eye out for that. You can check out our e-letter. This webinar has been recorded and will be up on our YouTube page this Friday. I've added the link to our YouTube page in the chat if you need that. And Dr. Hassett, do you have any parting comments for the audience?
Oh, just such a pleasure. And what makes it so exciting is I get to meet everybody in person. So I'm excited to get to see everybody from the foundation. And I know some of the individuals there, but my favorite is getting to meet the members. So I can't wait to shake your hands and get to know you. And if you get the book in advance, I'd love to hear your experience. That would be really phenomenal. So please, come to the conference, come find me. I'd love to chat with you.
Thank you so much, and I hope everyone has a wonderful rest of their day. Take care.